Hi everybody, Stacy from Staff Development. Just wanted to go over bag technique with you guys. I know everybody's favorite thing. Some of you may be using the new backpack, and some of you may still have the old blue 3-sectioned bag. Either is okay. We know this is what people are only getting now, so I'm going to show you guys on this, but we'll kind of refer to this a little bit as well. I know we make a big deal about bag technique. It is excruciatingly important to maintain infection control and to be practicing good bag technique when you're out with your patients, not only to protect them, but to also protect ourselves and our stuff, okay? So when you get into a patient's house or a patient's room in the facility, your 2 side pockets here and your side zippered pockets on here are considered your dirtiest, okay? So this is the only place where you should have your bag barriers and your hand sanitizer. So I'm gonna put my bag inside of a bag, first and foremost, so that I can set it down on any surface, hopefully a hard surface, but we know sometimes that's not possible. So I'm gonna put my bag inside of a bag. What if you happen to go into a home and there is absolutely no place for you to put your bag? Well, you'll see I have a trusty chair sitting next to me, right? So if I have to, I can hang my backpack over the chair, trying to keep the bag still on it as best as I can so that at least my bag stays clean if I don't have a hard surface to put it down on. You can also try to find a door handle to hang it off of, okay? So with my bag inside of a bag, I want to make sure I tuck my straps, and then I'm going to go into my other pocket and grab my hand sanitizer and another bag so that I can have a clean work surface to put all my clean stuff on, okay? I'm going to hand sanitize. About 30 seconds. Vigorous. This is my idea of vigorous. I want my hands to be dry. Okay, it's that drying that cleans my hands. Once my hands are clean, I can then go into my bag, okay? I want to be aware of anything that I may need to take out. I still have an old container. You guys probably have the single Sani wipes. That's okay. I'm gonna take out all my equipment, put it on my clean surface area. As many gloves as I need. Please remember, your gloves must stay in the box, okay? We can't take gloves out, shove them in our pockets, put them in the side pockets, put them in a baggie and put them in there. They have to remain in the original container. That's a Department of Health issue, okay? So I wanna take out as many gloves as I need. I'm gonna take out an alcohol wipe because I know, as so do you, that you only clean your screen of your tablet with an alcohol wipe. The other thing I'm gonna take out is a Sharpie, and I'll show you why. It's a little helpful tip for everybody. And then I have my tablet, okay? So I'm gonna kind of make room for my tablet here on my bag. Not a big space for a lot of stuff. I'm going to sit with my patient for a second and ask them, hey, how's everything going? I'm gonna take your vital signs, I'm gonna do your assessment, okay? I ask everybody to set their visit up this way because it makes it a lot easier to use your equipment all at once and then go about the rest of your visit while you put your equipment back here to dry. Because just like my hands need to dry, my equipment needs to dry before I shove it back into my bag, okay? Remember to zip your zippers once you get everything out. So I'm gonna take my vital signs, take my assessment. That's what my Sharpie's for. Should we be going back and forth, dirty to clean? My tablet is clean. My patient and my vital sign stuff is dirty. So here's my suggestion and my tip for you guys. Once you take a vital sign, you can take your Sharpie and jot down your vital sign on your bag so that you're not going back and forth into your tablet, okay? Just a little helpful tip. Once I am done all of my measurements, I can set my dirty equipment down in the patient's dirty environment until I'm done everything. Then I'm gonna put my gloves on, I'm gonna grab my Sani wipe, and I'm going to clean off all of my equipment right away, okay? Don't just let it sit around and then you clean it right before you leave. Clean it off right away. Once it is clean, set it back on your barrier to dry. Then, well, I took my gloves off because I always wear gloves with these, right? Carcinogenic, protect yourself, always wear gloves. I discard my gloves, sanitize again. Now I can grab my clean tablet, and because I was smart and I wrote my vital signs down here, now I can go in my tablet and put in all my measurements, okay? Then I go about asking my patient questions, doing all my documentation, checking in with the caregiver. Guess what? Now my equipment's dry. I can clean my hands yet again. Have that lotion in your car ready to go, right? Because your hands will be like sandpaper. Now my hands are clean again. I can open up my bag and put everything clean and dry now back in my bag, okay? I still have my alcohol wipe out here because I want to, once I'm finished with everything and I got the patient family to sign, I'm gonna use my alcohol wipe to clean off my screen, okay? Then I'm good to go. I can kind of tuck this back in here. If I still have my sanding wipe on, I can kind of clean the outside, or I can use my alcohol wipe. And then this is all trash, right? I can put all this away, okay? I can throw that all in the trash, clean my hands again, shove it back in my bag, and be ready to go, okay? Remember, these are the dirtiest places, your side pouches, okay? Nothing else should go in those except your bag barriers and your hand sanitizer, okay? That's where you go first before you enter any of the other parts of your bag, okay? In this bag, same thing. My hand sanitizer and my bags are going to be in the side pouches. Remember to close all your zippers. Once my hands are clean, I can go in and get all my vital sign equipment out, put it on my clean barrier, okay? Again, don't forget to zip those zippers. You don't want to take any creepy crawlies home with you. That would not be good, okay? When you're done, your visit, you're throwing everything away. Easy peasy, right? Bag never goes on the floor, ever, ever, ever. Even if you have 25 barriers on it, it never goes on the floor. Hang it on the back of a chair, find a door handle, wherever you want to put it, okay? If you go into a home one time and you go, oh my Lord, guess what? You can always order equipment for their house so that you don't have to take your own equipment into there, okay? But we always need to use a bag. We always need to have a barrier. If you go to the nurse's station, can you just shove your bag down on the nurse's station without a bag? That's not clean, okay? Same thing with your tablet. You shouldn't be at the nurse's station and put your tablet down directly on the nurse's station. I know it seems silly and simple. Gotta have a bag barrier, okay? We're talking nursing, aides, social worker, chaplain. If you have a tablet and you bring it into someone's house, unless you're gonna hold it the entire time, you have to have a bag barrier. You have to clean your hands, okay? Please reach out to Kristen or I if you have any questions about this. It is really, really important that we are maintaining good infection control and that we pass our lovely surveys coming up next year with flying colors. So we will have you demonstrate this for us during competencies, so you can use this horrid video as a good thing to do, and we will see you guys during competencies where you show us how to do this, all right? Thanks, everybody.